7th, 2012, meeting of the Human Services Committee will now come to order. Clerk, will you please call the roll?
Mr. Ansello? Here. Ms. Andrews? Here. Ms. Boyce? Mr. Daniele?
He's
Ms. Cayley?
here.
Mr. Lightfoot? Mr. Michike? Dr. Quattro? And Cheryl Monroe?
Here. I think they are here.
That's
right.
fine.
Okay, thanks. Is there anyone signed? I think we do have some speakers for tonight.
Yep. When I call your name, please come forward to the podium. You'll have 2 minutes and only 2 minutes in which to address the committee. Please conclude when the buzzer sounds. Our first speaker is Rita Lewis.
Hi, sister. Hi, sister. How are you?
Hello.
I just want to mention regarding Sally Green and what happened was so unfortunate for all of us who knew Sally and who loved her. What happened when she died and how nobody was notified, and then she ended up being buried without the people who knew her and loved her being there. And I just know in my heart that Sally has opened the way, has shined the light on what happens to people who die and are buried with no one there. And so I really hope, in light of all of this, that we never have to worry about having anyone buried at Awatka Cemetery. We have complained for years about Awatka Cemetery and how terrible a place it is for the poor to be buried there. And now the whole public knows what it's really like. I remember it was about a year ago, I accompanied a family to see Cheryl Clark at the county office for burials. And Cheryl, as I'm sitting there, Cheryl is proceeding to tell the family, oh, Awatka Cemetery is a beautiful cemetery. I said, no, it is not. And thank God the family that I was with understood what I was saying and would not go along with that. So I just hope and pray that we can no longer have any of our poor buried at Awatka. They should be buried at the other cemeteries like everybody else. Thank you.
Thank you, sister.
Our next speaker is Sister Grace Miller.
Hi, sister. How are you? Nice to see you.
Good evening. Good evening.
Good evening.
Okay. Sally Green was buried all alone in a cardboard box in the worst cemetery in Monroe County, Awatka Cemetery in Scottsville. She was buried there at the orders of the public administrator. I'm talking about a part of Awatka Cemetery, a muddy, swampy area where you sink in the ground when walking. A cemetery with sunken, unkept graves without markers. A cemetery where you often can't even get to the grave because it's so muddy. A horrible sight to any observer. This is where Monroe County and the public administrator believe all poor, homeless, mentally ill, the nobodies of our society must be buried. I want to tell you, your cover is blown, finally. Sally's family was never notified of her death. We went to the public administrator's office and were told they followed proper procedures. They consulted the telephone book. There were so many greens there, they couldn't possibly take the time to contact them all. I practically fell off the seat when I heard that. And I said to the public administrator, that was your job, to locate the family, no matter how long it took. But we know that if Sally had not been black, poor, homeless, the public administrator would have done the job. We are told that Sally died on January 19th, was buried on January 27th. A one-line obituary appeared in the papers on January 29th, 2 days after the burial. When we were visiting all these places, we were in the second week of February. Immediately after meeting with the public administrator's office, we went to the cemetery. We could not find Sally's grave. There was no marker. There was nothing there to indicate that Sally was buried at Oahu Cemetery. We called the caretaker. He came to the cemetery with a notebook, a regular notebook in his hand, and penned in the notebook were the names and dates of the people who were buried there. He said, here's Sally's grave. A yellow rock was the marker of her grave. And looking over his shoulder at the notebook, we saw Sally Green, buried February 2nd, 2012. And I asked the caretaker, I said, we're told that she was buried January 27th. You have February 2nd on your notebook. And he said, insisted, that's the day he buried her. We, the citizens of a dignified burial, are demanding, one, that portion of Oahu Cemetery that we call Pottersfield be closed, and the remaining graves be respectfully taken care of with markers. Put some trees there, put some plants there, make it look like a respectable grave cemetery for our poor. But no more do we want to go there. We want our poor to be buried in cemeteries in Monroe County like every other person who dies is buried. We also want the decision that Maggie Brooks made, that poor people would pay for their own burials, almost $3,000, be rescinded. And we want that all poor, homeless, mentally ill people in Monroe County be treated with dignity and respect which they deserve.
Thank you, Sister.
Our next speaker is Vincent Shelton.
I would like to begin by first thanking the legislators who came to the House of Mercy and treated the people with dignity and respect. Thank you. For years, we have complained about the services of indigent burials for the poor and the conditions of Oahu Cemetery. It's sad that it took the passing and treatment of our beloved Sally Green to bring this to fruition. In reverence of this and other related issues, we ask that a more compassionate and thorough system be implemented to ensure the quality of services for indigent burials of the poor. Further, we ask that the separate but unequal burial grounds at our Oahu Cemetery be upgraded and above-ground markers be used so family and friends can easily identify their loved ones. Thank you.
Our last speaker is Kevin Robinson.
I'm Kevin Robinson. I'm actually going to talk to you about the problems I got with DSS. I'm sure you're aware that with all these changes, no one has a worker. Everybody's doing this team effort. It's not working. We're having problems getting faxes through. We're having long lines. Matter of fact, Westfall has no lines. You can go in there and eat a burger in a line. You know what I'm saying? You can get right to a worker. At St. Paul, you have to wait. The lines wrap outside the door. It's bad enough you have to go through security, and now they're taking lighters like we're in there, I suppose, smoking or something. The line is going out the door. Even the line that you actually put your information in an envelope for a worker to get, that's going down to the bottom of the steps. I don't know what you guys can do, but it has to be fixed. Give us back workers, get more workers, open up more windows. There's a problem. And it's not getting any better, it's just getting worse. Your appointments, you get I personally was given an 11 o'clock recertification appointment because I'm on medical. They saw me at 10 minutes to 2. One of the issues is that because I can't stand that long, can't sit that long, I have medical reasons. So if I'm standing in this line for an hour just to get to the window, then I'm sitting down, you have to drag a chair into the line to sit down because you can't take it. Or you do that fancy dance because you got to go to the bathroom. And hopefully the person behind you will let you get back in line. I just think that with the long lines, 2 and 3 hour appointment waits, no lines at Westwall Road, faxes not getting through, not having a worker, I think you guys ought to really do something. And then you have social workers asking for raises. Let them do their jobs first. Thanks.
Thank you. Is there anyone else present who did not sign up to speak that would like to speak tonight? Seeing none, the next item on the agenda is the approval of minutes. You have before you the February 28th, 2012 minutes. They stand approved unless the clerk is notified by any changes by the end of today. Next item on the agenda is new business. Madam Clerk.
Referral 12-123.
Moved by Legislator Boyce, seconded by Legislator Michike. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration. This $2+ million we're getting from the state, this is the Child Care Dollars program, is that correct?
Through the chair, that is correct. This is the Child Care Dollars program.
And this is, through the chair, this is the money that we discussed around budget season that we had just received word of that we would be receiving. Is that correct?
Through the chair, that is correct.
So with the large increase in the allocation from last year, which is wonderful, obviously, what is the number of children that we expect to serve with the $2 million?
Through the chair, with this new allocation, we estimate a monthly average somewhere between 400 and 450 children.
And what sort of increase through the chair is that from last year?
Through the chair, that's actually kind of a tricky question to answer. Excuse me. At its peak, this program served just over 600 children. That would have been late 2009, early 2010. This group may recall the Child Care Dollars program actually shut down, I want to say July and August of last year. Funding was fully utilized under the grant. And Children's Institute did not begin accepting new applications until, I want to say, mid-December for a January 2nd start date, 2012.
Okay. Through the chair then, so for the months that this program was operational last year, what were the averages?
Through the chair, for the several months in 2011 that this program was operational, I don't have the exact average in front of me, but I'm confident to say that the number of children served ranged from 500 to 600 children per month.
Is there any other discussion on this?
I have a couple more questions, yeah.
Legislator.
Thank you. So why would we see then a decrease this year if the range?
Through the chair. Yes. Through the chair, please,
I
Legislator.
haven't finished my sentence yet. I'll add it at the end. So why then this year would we see a decrease in the number of children served per month if there's an increase in allocation through the chair?
Through the chair, this is a somewhat interesting program. I can't explain why, but Monroe County has not received annual allocations under this program from New York State. Rather, somewhat large allocations come not every year, but every couple years. Up until 2011, there had been approximately $8 million in allocations dating back to 2006. Each year, a certain portion of those dollars were carried forward into the next year, and they accumulated. So an allocation for one particular year was often augmented by carry forwards from prior years.
So through the chair, then if I follow you, so then last year, according to your figures of 500 to 600, that could have been because of revenue carried over from the previous year?
Through the chair, that is correct. Through the chair, I would also like to add on that there was a brief period of time, I would say late in 2010, when the Child Care Dollars program took on additional children with incomes between 125 and 165%. That 2 or 3 month infusion added, I want to say about 135 to 155 children.
Okay. Through the chair, then, so is this funding going to be all used for families that fall within the income levels from 165 to 275% of the federal poverty level?
Through the chair, that's correct.
Through the chair, does the way the state gives this to us not allow us to direct it towards the lower level, below 165%, or is that at the discretion of the county?
Through the chair, the state appropriations bill specifically earmarked this funding for the funding up to 275%. The way Children's Institute structures their contract with New York State OCFS is that they pick up where the county leaves off.
Okay, so it makes sense through the chair then for them to pick up at 165 and go to 275.
Through the chair, that's correct.
Okay. At this point, could I just request then a breakdown again of up to date through March of the 5 programs of child care and the number of kids served and the monthly averages that you can usually provide to me, please?
Through the chair, we can do that.
Great. Thank you very much.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed, item carries. Next item.
Referral 12-124.
Moved by Legislator Michikay, second by Legislator Ansello. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration. We'd received some correspondence from concerned parents, I believe, and providers regarding the early intervention program and what I guess they perceive to be some cuts. Could you just, I assume you've seen some of that correspondence as well. Could you just speak to that? I mean, is this program changing significantly under this proposed state budget that's about to be adopted, or perhaps has been, or is it essentially going to be the same? Through the chair.
Through you, Madam Chair, there have been discussions in the back rooms, I guess, at the State House about how this program might be changed, but we really don't know what the outcome of that will be.
So at this point in time, through the chair, then you don't have any idea if it's changing or not changing?
At this point, there's some rumors flying around, but I don't really think it would make sense for us to start speculating about that. Through you, Madam Chair.
Thank you. Okay. Through the chair, would you be comfortable just sharing with us what rumors you've heard about it? I mean, what could be the possible changes? I mean, is it going to affect service delivery or provider reimbursement rates, or what is it that's really being discussed?
Madam Chair, I can't comment on specifics. I can say that we did receive an update within the last 2 hours or so. The budget agreement in Albany, as I understand it, among the three parties, rejected all of the governor's proposed reforms. So I don't believe any of his proposals will be enacted as part of the budget.
Great, thank you very much.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-125.
Moved by legislator Ansello and seconded by legislator Quattro. Any discussion? Legislator Cayley.
Thank you, Madam Chair. Through you to the administration, the referral indicates that there's a slight increase. Is there any particular reason for this? It is slight increase to happen, and could we expect that this is going to happen again?
Through the chair, the slight increase is really to account for other increases that have occurred, including like a 2.5% increase in lab fees, as well as like a 5% increase in administration fees.
Thank you. So, okay. Thank you. And again, through the chair, since this is the 10th, am I reading this right? 10th year of this intervention grant, could we get a statistical breakdown perhaps of the trend with the test results as to whether or not we are seeing a decrease or increase? I realize that it reads that this is just testing, but is there a decrease happening as a result of this testing being done? And that could be submitted at a later date unless you have it now.
Through the chair, with regards to our actual number of cases, in year 2003, we had 2,977 cases of chlamydia. 2004, we had 2,807. The year 2005, we had 2,638. For the year 2006, we had 3,015. For the year 2007, we had 3,193. For the year 2008, we had 3,497. For the year 2009, we had 5,117. For the year 2010, we had 5,767. For the most recent year for which we have data, we have 2011, we had 5,003, representing about a 13% decrease from the prior year.
Thank you. I don't know that through the chair I would ask you to speak to why there is such a dramatic rise, but perhaps we could talk offline at a later date. Thank you.
Legislator Lightfoot.
Through you, Madam Chairwoman, I would like to ask the administration could define in this referral, in paragraph number 2, first sentence, it says chlamydia in high-risk populations. Can you define through you, Madam Chairman, what is the high-risk populations? And also in the fourth sentence, it says serving high-risk adolescents. I'd like to know the definition of those two terms through you, Madam Chairman, to the administration.
Through the chair, and generally Monroe County is considered a high-risk population with regards to other regions of the state. And then within Monroe County, there are specific subpopulations that are more high risk, and so those actually include females who are under the age of 25 who are sexually active, females who are age 25 and older who have additional risk factors such as a new sex partner or multiple sex partners.
Thank you. I guess I'm just trying to, you say Monroe County is considered high risk, so that's the whole county of Monroe, compared to you, Madam Chairman, other counties in the state. Is that what I'm understanding you're saying?
Through the chair, that is correct.
Okay. And if I didn't understand properly, could you just reiterate again, through you, Madam Chairman, to the administrator, what makes Monroe County have high-risk population and or high-risk adolescents? Other than these other counties, what do we have differently than these other counties, through you, Madam Chairman, to the administration? Is it our numbers, through you, Madam Chairman, of the amount of chlamydia, like the numbers that you just ran off of us having? It appears to be about an average of about 3,000 cases of chlamydia. Is that what makes us high risk? Through you, Madam Chairman, to the administration?
Through the chair, yes, it certainly includes our high rates that we have that I just went over, but it also includes to some extent, other risk factors, such as the ones that I mentioned already. In short, we don't exactly know the full answer in terms of why, Monroe County is higher. We do know that in addition to some of our rates that we have, that we do a very good job in terms of detecting, not only in terms of our clinic, but also our providers. And so in many cases, when you're looking for something harder, you have more capacity to do the looking in the community, you are more likely to actually detect more cases.
Thank you. Through you, Madam Chairman, to the administration. Also, I'm looking at the transmittal disease clinics. I'm aware of how many school-based health centers do we currently have in Monroe County? Through you, Madam Chairman, to the administration.
Through the chair, I believe we have 5.
Okay. Through you, Madam Chairman, to the administration, are those 5, their geographical locations, are they by quadrant? Is every area of our county in somewhat being, do you see being easily accessible? Is there a clinic, I guess to be more specific, through you, Madam Chairman, to the administration, other than the main Westfall or Main Street clinic there in Bull's Head? Is there a school-based health center in the southwest area of our community? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, that is the one part of the city of Rochester that does not have a school-based clinic in the high school that's located in that quadrant.
Okay. That really bothers me. Through you, Madam Chairman, to the administration, being that I know that if we're saying Monroe County is high risk at all, I know that's got to be broken down into also zip codes are even more higher risk, and I'm sure, through you, Madam Chairman, to the administration, that the 14608, 14611, that particular zip code, I'm sure has high cases, and I would really like to see, are these needs that are not being provided there through a school-based health program at that particular high school, are they being met some other way? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, the main Monroe County Department of Health STD clinic is in Bull's Head Plaza, and so we believe that we provide very good services in that part of the community. In addition, Westside Health Services is over in that area and are right across the street from the high school in that area. So I think that services are okay. I know there's been discussion about trying to get a school-based clinic in every high school in the city of Rochester, but for a variety of reasons that hasn't happened. The current superintendent is committed to that, and I know that there's some plans in the works to try to use some of the capital dollars that they have available to them to do some renovation and make space available from former classrooms for converting some of them to school-based clinics.
Thank you.
Any other discussion? Legislator Boyce?
It would be Boyce. Yes, through the chair, to Dr. Doniger, even though there isn't a school-based clinic in that area, there is community-based agencies within that area. Do we know where the referrals are derived from that go over to the clinic at Bull's Head?
Through you, Madam Chair, you're sort of asking what the distribution of the patients by zip code is?
No, I guess I would, even though there isn't a school-based clinic, I'm wondering if we do get referrals from the school that exists there, the Wilsons, and the community-based agencies that exist within that community area, through the chair.
Through you, Madam Chair, I don't know so much that we get referrals. I think people just walk in the door and receive services.
Okay.
And I believe that we see more patients from Southwest than from the northeast part of the city, just because we're located there.
Thank you.
Any other discussion? Legislator Cayley.
Thank you. Through you, Madam Chair, to the administration. Given that Rochester is probably the highest risk area, but Monroe County is a high risk county in itself, how is testing outside of the city area conducted, and have those numbers risen as well? Thank you.
Through you, Madam Chair, we don't have the statistics of the rates of chlamydia infection in the city versus the suburban towns, but I think that it is reassuring that the rate of chlamydia infection for the county as a whole has started to go down. It's been going up and up and up throughout the whole country and in Monroe County for the last 5 years, and we wondered whether it would ever stop and start to go down. And so for 2011, we've seen a downturn, and that's very gratifying. Your question, I guess, really, though, was where are the patients that are living in the suburbs, where do they get their services? And presumably they get them more or less from the private practice of medicine providers in those suburban towns. The users of the clinic are predominantly, the users of the public clinics are predominantly from the city of Rochester.
Thank you. Any other discussion? Legislator Lightfoot.
Yes, thank you, Madam Chairman. To you, Madam Chairman, to the administration, I'd like to ask for, if it's possible, to get the data from the Bull's Head Plaza particular site, a breakdown of maybe the last couple of years, STD data, and also age, how many cases that we have at that one particular office is what I'm interested in. To you, Madam Chairman, to the administration, is that possible to get that data?
Through the chair, yes, we can provide the data.
Thank you.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. At this time, under unfinished business, I would like to let all the members of the committee know that I requested a copy of the policy that from the Public Administrator's Office when they attempt to contact families of indigent people who die in Monroe County. When I receive this policy, I will pass it along to each and every one of you on this committee. At this time, I've also asked Commissioner Kelly Reed to come and speak to us tonight to give us a brief synopsis of the burial assistance program that we do here in Monroe County. So at this time, I think, Commissioner Reed, you have the floor. Thank you for coming.
Through you, Madam Chair, you're welcome. Happy to be here. With regard to the indigent burial program that's handled through the Department of Human Services, it's important to recognize a couple of things. One is that indigent burial for us is a little bit different than that covered by the public administrator, because in our cases, there's family that comes forward to identify the person involved. The first thing that happens is that there is a means test that is required by New York State to determine that a person is in fact indigent, and the temporary assistance guidelines help us in that regard. Following our determination that a person does meet the guidelines of indigent, we then have a definition of what constitutes an indigent burial. And my colleagues from the advocate community who spoke this evening referenced the Citizens for a Dignified Burial Community group. They worked with the Department of Human Services and a bipartisan group to help identify what constitutes an indigent burial. That was a conversation that occurred with funeral home directors, and that was quite a few years back when, approximately 6 years back, when we worked with the funeral home directors to determine that a funeral that cost no more than $6,000 would be identified as an indigent burial. A funeral costing more than $6,000 would be a situation where the decedent would not be identified as being indigent. As far as indigent burials go in this community, each year we have a general cost to the community that ranges somewhere between $750,000 and $900,000 that is applied toward a cost of an indigent burial. And in Monroe County right now, the indigent burial expense is $1,250 per indigent burial for a funeral that costs $6,000. $1,250 would be paid by the county, and $4,750 would be paid by friends and family members of the decedent. Monroe County's cost is reimbursed by New York State as the lesser of 50%, or $450. The remainder is borne by Monroe County local taxpayer dollars. We work very closely with the families, and I know that the specific request was to have Jim Roos come in. He is our coordinator of faith-based initiatives and manages the indigent burial program. So we do work with the families, and we also work with the advocate community. The case of Sally Green recently called to attention the fact that our representatives from the Monroe County Department of Human Services had not worked, had not called together the group for Citizens for Dignified Burial in some time. So we've agreed to sit down with that group to talk about what the concerns are. We did sit down recently with them, and we'll be sitting down with them again to address issues related to it from the Department of Human Services side of the house, which is different than the public administrator side of the house. And then if you have any other questions, that's kind of in a nutshell what happens on our side.
Thank you, Commissioner.
You're welcome.
We appreciate all your time for that. If at this time, if you'd like to answer some questions, I will open them up to the committee. Legislator Lightfoot.
Yes, ma'am. First of all, thank you, Madam Chairman, and I'd like to, through you, Madam Chairman, thank Kelly Reed for coming, Commissioner Reed for coming here and helping us shed some light on this issue. Truly, it is an issue that I think we've been all concerned about. I do have to ask a question to you, Madam Chairman, to Commissioner Reed. You mentioned about a constitution with the burial bipartisan group. Is that a document, this constitution, was that something that was drafted as a result of your meeting was between the burial bipartisan group with the funeral directors? Is there a document, through you, Madam Chairman, to Commissioner Reed, that the Department of Human Services has that explains the procedure or that is the protocol for burial procedures? Is there such a document?
Through you, Madam Chair, I'm sorry, I think you might have misheard me. I said that there was a meeting that happened to determine what constitutes an indigent burial.
Gotcha. Okay, so out of that, question still the same. If they're meeting, out of that meeting, obviously there were some things that derived. Were those things, through you, Madam Chairman, to Commissioner Reed, what does the Department of Human Services go by in the event? I understand the procedures you just gave us. Is there a protocol or something that allows you to go through the steps to make these procedures done? Is there anything in documentation that could be provided to this body that will explain everything that you just said? Through you, Madam Chairman, to Commissioner Reed. Policy.
Through you, Madam Chair, Legislator, can you clarify for me, are you asking for documentation of the process to apply for indigent burial funds, or the process to determine whether someone is indigent and eligible for burial funds?
I'm asking for the first part of what you said, through you, Madam Chairman, to the administration. However, I think what I'm saying is, for instance, just to put it in this system, if we have a situation where someone comes into your office, right, and they're one indigent burial, at that point in time, what constitutes the Department of Human Services? What documentation, what policy, SOG, procedure, or documentation do you have when we have a house fire on the fire department? Certain things, we have a SOG that tells us exactly how to handle a particular situation. I'm asking for the SOG or the policy of the burial of the Monroe County burial, indigent burial procedures. I haven't been able to find them in the 6 years that I've been with this body, and I don't know why it's so difficult. If there's to see what is the driving force behind written wise that tells us what to do in the event that we have an indigent burial. is such a policy exist, through you, Madam Chairman, to Commissioner Reed?
Through you, Madam Chair, could you tell me what SOG stands for?
Standard Operation Guideline.
Okay.
It's a guideline, or SOP, Standard Operating Procedure, or policy, and, depending on how you want to look at it. To you, Madam Chairman, to Commissioner Reed.
Through you, Madam Chair, they exist inside the Temporary Assistance Guidelines and the regulations that guide the work that we do through New York State.
Is it possible to get a copy of these guidelines and policies or where can you refer us to? How do we get them? Can I have a copy? Do you, Madam Chairman, to Commissioner Reed?
Through you, Madam Chair, I'd be happy to provide the guidelines for you.
Thank you.
Any other discussion or questions for Legislator Cayley?
Thank you, Madam Chair, and thank you, Ms. Reed, for coming in today. I do appreciate it. I will say that I have been involved in more than one burial process, and I realize that it is a difficult process, especially when there are family members that are there and not in understanding of what's available, what's not available, and then very upset when they hear what is available. And this has ranged from an infant to another individual who was totally alone. And I have to say, in only one case was the outcome comfortable. So, and I guess what concerns me is that's difficult for me to get my hands around, that a process that is designed to bury someone that has little or nothing and the family to allow for closure. And what I find, I still find that there are inconsistencies in the process, but then again, I will come back and say that some of those inconsistencies will come out of the family disposition and whether or not there is family or not. But I did have another question, more specifically, in that I'm hearing a different number that I believe I heard before, so I wanted to understand that the state reimbursement, the max state reimbursement that Monroe County would receive would be a matching payment of $450, or did I not hear you correctly? Because I believe I heard at one time it was $625.
Through you, Madam Chair, it is a maximum of $450, and it has been that amount of money at least since I've been here. My colleague is telling me at least for decades it has been.
All right, because we did hear that it was 50% of the $1,250, but that doesn't compute, and someone else came forward with a maximum state amount of $900 as long as it was only up to 50% of what the cost was. So those figures are not correct then?
Through the chair, those figures are not correct.
All right. Through the chair, Legislator Lightfoot has already asked for the process in writing, and that will be very helpful. What I'd like to ask in part of that, and I'm not sure that this is available, but this goes back to one particular issue that happened with a different family, when we find that a person cannot come up with the correct amount or the amount to be buried. Is there ever a timeline where the county steps in and reaches into, which is another question as well, reaches into the additional fund that is separate from the county's fund, and I'm not even sure that that is funded at this point, to help a family bury an individual that's passed, and they cannot come up with a full amount to finish that burial process? In other words, is there a break-off point of having a person not be interred?
Through the chair, I believe you're referencing the Community Burial Fund?
Yes, thank you.
Okay. And yes, there have been times when individuals have applied to be considered for the Community Burial Fund. Managed, that money is not managed by Monroe County, it's managed by a group whose name just recently changed to Faith in Action. And yes, individuals can apply for funds from the Community Burial Fund.
And then through the chair, I realize that this is a private fund and it's privately funded. Is there a balance in that fund as we speak? In other words, is that, through the chair, is that entity in contact with the county to assist in this process, number one, by telling them that they have a balance, and number two, by having a process in which individuals are referred to them, or, I guess, what's that process? Thank you, through the chair.
Through the chair, yes, there is a balance in the account. I'm not familiar with what that balance is this evening. And yes, there is an opportunity for people to request consideration through that fund.
Thank you. And then through the chair, how does the family find out that that fund exists? At what point in the process? Through the chair.
Through the chair, that sometimes comes through the advocate community. It is also something that is brought up during the interview process with our burial coordinator.
Okay, thank you. For a later point, in not too long future, could we obtain the balance that happens to be in that fund through the chair?
Through the chair, I'd be happy to find that out and provide it for you.
Thank you. And through the chair, in the group that you're meeting with again, this is the one particular advocate group. Are there any other ways for input to be given to that group to consider? And I speak out of personal experience as I have visited the grave sites, multiple grave sites, and I could point out inconsistencies that don't necessarily come from the burial process, but actually come from the services that are provided by the individual funeral directors and the cemeteries themselves. And these are inconsistencies that happen, creating heartbreak at some point. And I would like to be able to submit some of my concerns, my personal experiences, and perhaps ways going forward that these could be addressed, since both the funeral directors and the cemeteries themselves are receiving funds, not much, I admit, but some funds from the county itself. Through the chair. So that's a long question to say, when will input be allowed to be given to this process by those other than that committee and your service yourself?
Through the chair, if you'd like to send a memo to me with regard to those things, I'll absolutely make sure that they get discussed at the meeting.
Thank you.
Thank you. Any other?
That's it for me.
Legislator Andrews? Question?
Thank you, Madam Chair. Thank you, Commissioner Reed, for coming this evening to address us about this. I just have a few more questions. Actually, my first question is to the chair. I think we had also requested the public administrator be present to address some questions. Is he going to be able to come? Why wasn't he? Number one,
I spoke to the public administrator, and they're in the process of putting the policy together, and he will get that to me, and I will get it to the committee.
So he didn't have a policy already?
They do have a policy. They're actually updating. They're looking at their policy and updating it. They will be getting it to us, and I will present it to you.
Great. Would it be possible that you could ask him to provide his old policy as well as his updated and new policy?
If you want to request a letter from me through the chair, I will certainly take a look at that and pass it on through.
And could we request him to, once his new policy is in place, could we request that he come to this committee to address our questions and explain the new policy?
I think that's something that after we look at the policy and see if we're comfortable with that we can make a decision if we're happy with the policy, but we can certainly take a look at that.
Well, regardless of whether or not we're happy with it, it'd be nice to have him come forward and answer some of our questions and explain it to us, both the reasons for making the updates, if they're not obvious, as well as, answer some questions about perhaps what went wrong, regarding Sally Green in this case.
I wanted to make sure that we had the completed policy and before we made any determination about that, so.
I know, but this is his policy, correct? And so it seems like it'd be better for him to come to speak to his policy than for us to review it and make a determination as to whether or not he should come.
Certainly, I will certainly take a look at the policy when I get it, and I will be in contact with him. I've already spoken with him before, and I will be speaking with him again.
Great, well, I hope that he's able to come. Do you have an idea of when he's going to be doing the
Do not by
policy?
the next meeting, by the next Human Services meeting in April,
Okay.
I was told. Thank you.
Do you know, are the changes he's making in the policy, I mean, you seem to know more about it than I know I certainly do. Are those in response to what happened recently? Is that why he's changing it?
All I can tell you is that I've spoken with them. They are in the process of looking at looking at updating this policy and how they, how he does business with us as the public administrator. Yes.
Okay. Well, certainly I do hope that we as a committee who have, sort of authority to oversee this topic will feel it important enough that he come in person to speak to it, not just us have an ability to read a policy. So I hope that happens for our next meeting. Just in addition to that, could I request through you to the administration of the past 5 years how much the county has spent on its burial policy, our burial program, be provided, as well as the specific budget codes that funding comes out of?
Is that
either to you or to the, yes, you or another representative of the administration?
Through you, Madam Chair, we can provide that.
Thank you.
Thank you. As well as just, I mean, not to be morbid, but just also know the number of indigent burials that we've had in each of those years, so we get understanding of that data as well. For each of the 5 years that I've requested the information for, can that be provided as well, Commissioner Reed?
Through you, Madam Chair, yes, it can.
Thank you. As it was explained this evening, the state provides reimbursement to the county for up to $450 per burial. Those referrals don't come before us. We don't, or do they? Through the chair?
No.
To accept that funding?
Through you, Madam Chair, no, they don't.
And then just lastly, I'm not incredibly familiar with this, but the HOPE initiatives for $60,000 that the county entered into a contract with HOPE initiatives to administer the program in 2007. Is that contract still valid through the chair?
Through you, Madam Chair, no, it is not.
Okay. Through the chair, then who's administering the program now?
Who manages the fund now? What's the group? Through you, Madam Chair, it's the group that's managing it now is called Faith in Action.
Okay, I was wondering, because that's what you referred to earlier in the evening, correct?
That's correct.
Okay, thank you very much. I look forward to continuing dialogue.
Thank you. Any other discussion? Legislator Boyce?
Through the chair to Commissioner Reed, and maybe not a question to you, but might be more to Deputy County Executive Mr. Helfer. I just point of clarification: the burial site that the indigent are buried in, is that not in Monroe County, sir?
Chair, yes, it is in Monroe County.
And the property that the burials are actually on is referred to as Oaka or Potter's Field through the chair. Is that not a Monroe County park, or is that other property?
Madam Chair, I'm informed that it's a private cemetery, but it is a 501c3 corporation,
Oh, okay.
not for profit.
Okay, thank you, sir.
Thank you. Is there any other questions for this regarding this? Okay. Thank you. Thank you again, Commissioner Reed, for coming tonight.
You're
Appreciate
welcome.
that. Is there any other business that comes before us tonight? Legislator Anders? Unfinished business, I should say.
Yep, thank you, Madam Chair. The past couple of months, we've brought up the issue of the therapeutic foster care program. I wondered, since Commissioner Reed is here, if just had an opportunity to ask her a couple of questions about that. I'm trying to figure out what exactly has happened, but my understanding is that we apparently are no longer contracting for that work with the purchase of service contracts and are doing it in-house. Is that accurate?
Legislator Anders, I would like to wait and address that. I've not received any information from you on that, a letter on that from you. So if you would like to request something through the chair, I would request it to go through the administration. Thank you.
Actually, Chairwoman Draw, I think I brought this up in our January meeting, And you told me to do that, and I do believe I submitted this in a letter to you, and then in last meeting, I wasn't able to be here for work obligation.
Commissioner Reed did come and speak last meeting on the foster care
And she's here
program.
again this evening, and if she's able to answer the question. It's not a trick question. I'm just trying to figure out what happened to the money and making sure we're meeting the needs.
If you would like to ask her one question regarding this.
I'd like to ask her a few questions. It's my right to ask her some questions. I mean, she's present. We're all here. It's the work of the county. I mean, this gets really old.
If
going
you'd
through
like to
these
ask
hoops.
a question for her, she was here for quite a while the last meeting, and and talked about the foster care program extensively.
I believe my colleagues deferred and said we would like to speak about it again this month at last month's meeting.
Please ask a question for her then.
Commissioner Reed, through the chair, could you just explain what happened to the therapeutic foster care funding and how that program's now being run?
Through the chair, one of the things that we've talked about a lot of times here in these chambers is that the Department of Human Services purchases what it needs at any point in time for the children and families that we serve. When we implemented Project SAVE, we were able to, over the course of the 3 years from the time it was originally implemented, to reduce the foster care caseload that we managed internally by just about 50%. In the course of that time, we also participated in some significant quality improvement in the skill base for the workers, our own foster care workers. As a result of both things, we made the determination that these 2 small contracts that we had for outsourced therapeutic foster care were no longer necessary. Most of the children that remain in foster care now, that we had 53 children in therapeutic foster care at the end of 2011. Most of the remaining children, the remaining 500 children that are in foster care here in Monroe County, that's an approximate number, would qualify as children that require therapeutic foster care. And the workers, the Department of Human Services workers, are prepared to provide that service. So we made the determination that we would no longer be outsourcing any of that work. We had 2 contracts, one with Catholic Family Center, one with Hillside. We notified them that we would be ending those contracts and that we would work with them to transfer those young people and their foster parents between the point of passage of the budget through June of 2012 into the Department of Human Services program. That's what we're in the process of doing now.
Thank you. And so you feel confident that we'll be able to provide those services at a high level in-house? Through the chair.
Through the chair, I feel very confident that that's the case. By regulation, Monroe County already had a foster care worker as a Monroe County employee working with those families, as well as the one in the contracted agency. So we were already delivering some of that service on our own. And again, I would emphasize that the vast majority of the young people that remain in care in Monroe County would qualify as those needing therapeutic intervention services. The workers in the Department of Human Services are well trained to address those issues.
Thank you. And through the chair, could you just tell me the values of those 2 contracts you mentioned that were terminated?
Through the chair, I can't answer that for you tonight.
Okay, if you could
I can get
follow up.
that for you.
That'd be helpful. And then is that same amount of, my follow-up question would be then, is that same amount of money then going to be directed to run the program to meet the needs of the 53 children now that we're going to be running it, or are we just assuming the costs into funding we already used to run foster care? Through the chair.
Through the chair, well, we would be doing it less expensively because we were paying a daily rate on top of the state reimbursed rate to both of those organizations as a daily incentivized rate. However, it's also important to point out that we buy what we need. So the young people that are in these programs will also receive other forms of service different than what the foster care worker would be providing for them. If they need some sort of day treatment program, we would be purchasing that as well.
Okay. Thank you very much for answering my questions. I appreciate it.
Thank you. Any other unfinished business? Seeing none, the March 27th, 2012 meeting of the Human Services Committee stands adjourned. The next meeting will be April 24th, 2012 at 6 p.m. Thank you.